Okay, great. Hi, everybody. My name is Mona Loutfy. I'm the moderator for this session, the last session for today, entitled Layered Realities, Sex, Desire, Race, and Health Among Gay and MSM MENA Youth. I'd like to start with a land acknowledgement. Myself personally, I live on the traditional territories of the Anishinaabeg, Haudenosaunee, and Huron-Wendat in Toronto, and Toronto is covered by Treaty 13 with the Mississaugas of the Credit River First Nation. I acknowledge the land on where I live and work as part of steps, personal steps towards truth and reconciliation for Canada. And I acknowledge that I'm a settler on this land and have benefited through colonization. If you haven't read the Truth and Reconciliation Commission of Canada, I highly recommend that you seek it out and read it. Okay, so here's our session agenda. We're going to start with welcome and introductions. And then one of our panelists, Ahmed, and peer researchers is going to give an overview of the findings from the MENA youth who identified as gay and or as men who have sex with men in the study. And then we're going to have a discussion question and panelist periods, and you'll be open to ask questions as well as the audience. Again, some ground rules for the session today. We're committed to creating safe spaces for community engagement through respectful and non-judgmental dialogue. So this applies to all of us as we speak and as we enter anything into the chat. Please mute your microphone when you're not speaking. There tends to be a little bit of an echo if there's two microphones on at the same time. You can use the emojis in the chat, and you can also show agreement and encouragement or pose a question. You can't raise your hand, so for the panelists, if you feel like answering, just wave to me so that I know that you're interested in answering that question. And again, please feel free to use the chat if you have a question or you would like to make a comment. Please pause and listen closely. Sometimes there's a lag on Hopin that can cause us to talk before someone has completed their comment. Okay, so here I am. I'm the moderator for your session, and here's my introduction. I'm Dr. Mona Loutfy. I'm an infectious disease specialist and full professor at the University of Toronto and Women's College Hospital. My medical practice is in inner city Toronto at the Maple Leaf Medical Clinic, where I mainly practice HIV with women, couples, and youth. But I also founded the Maple Leaf Prep Clinic in 2018 with Dr. Philippe El-Halou, where we provide an essential sexual health service to the surrounding community. Next slide. And it's also my pleasure to introduce and welcome our panelists. Ahmad Ezzeddine is one of our panelists and presenters. So Ahmed is a peer research associate with the YSMENA study, in which he was a part of facilitating the focus groups for the study. He has a master's in business administration and is currently getting his degree in social work. Since immigrating to Canada, he's been always interested in finding ways to impact and give back to his community. Ahmed has been involved in several sexual health promotion campaigns within the LGBTQIA+ community. Also, Ahmed has been volunteering with several HIV/AIDS organizations in Toronto in programs supporting newly diagnosed folks. Thank you for your work, Ahmed, and welcome. Kiro Salib, welcome, Kiro, and I'm excited to read your introduction. Kiro, an Egyptian-born, queer, Coptic, HIV positive, non-binary, and drag performer, has been advocating for YSMENA groups in Toronto since 2014. They are the creator of the Raha program at the Alliance for South Asian AIDS Prevention, a program for Middle Easterners living with, affected by, or at risk of HIV and/or AIDS. They are also the founder of the popular party for LGBTQIA plus people, Middle Eastern Nights, which I want to go to now. An event that brings the community together to celebrate their home, culture, and music. Kiro is an activist on sexual health education, mental health support, and substance use counseling. Having battled homelessness, rejection, racism, and drug addiction themselves, they were empowered to be available for a community who is very often put on the back burner when it comes to these challenges. Today, Kiro works at Action Positive, a French aid service organization in Toronto, serving all walks of life in the community, building bridges and reducing barriers to accessibility and health needs for Francophones in Toronto. Thank you for your work, Kiro, and welcome. Our next panelist is Dr. Mazen El-Baba. Mazen is an emergency medicine resident physician at the University of Toronto. He also completed a master's in neuroscience at the Brain and Mind Institute at Western University. Mazen is always eager to find ways to combine his academic and non-academic interests in ways to positively impact his community. He's the founder and director of HAPPY, a nonprofit organization that works with children who have faced adversity throughout their development. Mazen has developed and supported local and international programs that support at-risk youth, which include summer camp programs for refugee children and mental health encounter groups. Thank you, Mazen, for your work and welcome. And our last panelist to present, but definitely not least, is Maher Sino. Maher immigrated to Canada in 2014 and has acquired a double major in peace, conflict, and justice studies and theater with a minor in psychology. Through their research, Maher has centered decolonization and anti-oppression. Maher has since focused on their artistic journey, collaborating with organizations such as Buddies in Bad Times, Cahoots Theater, and Theater Passe Muraille as an outreach coordinator. Maher currently works with ASAP in sexual health and peer support and volunteers for ACT and Pride Toronto as a director on its board of directors since October 2020. In 2016, Maher also served as a peace educator in a Syrian refugee camp in Lebanon, and currently Maher is developing their own artistic collective. Maher, I really want to see your art that you've spoken about, and thank you for your work and contribution, and welcome. And now I'm going to pass it over to Ahmad, who's going to give us an overview of the findings from the gay and MSM identified MENA youth from the study.
Thank you, Dr. Loutfy. Thank you a lot for the introduction. So what I'm going to be doing is presenting a bit of the findings that we found interesting within the MSM focus groups that we did. But first, let me just walk you through a bit about the methodology and the process we went through. So we've done 14 focus groups for most of the different gender identities and sexual orientation, in which 6 of them, which is the most of the groups, were within the gay and MSM identified MENA youth. 55 participants shared. We had 6 trained peer research associates, which I was one of them, who led these focus groups discussions. Also, so how it happened, we had the same group come twice for first focus group discussion about intersectionalities, HIV, and access to healthcare, and a second focus group which was more discussing interventions. And also, we had a third group, which was combining folks from different sexual orientation, different gender identities to discuss the intervention-based focus group. So all these data was coded and analyzed using in vivo so that we had the key findings that I'm going to be discussing next. Next slide, please, Vijaya. So this is just an overview about the participants. We have 55 MENA youth who were aged from 16 to 29. 79%, which was the vast majority of them, were not born in Canada, were born in MENA countries. And this is I guess it's more Middle East than North Africa, the countries we can see. Also, within the identification of their gender identities and sexual orientation, as Dr. Willa mentioned before, we over recruited from the queer identified based on the needs of the research we had. Next slide, please, Vijaya. More about the MSM identified MENA youth we participated. We can see that none of them were born in Canada, which tells a lot about they're all new immigrants, with 50% who lived in Canada from 4 to 9 years, and the average age was 27 years from the participants. Next slide. Some demographic overview. So I'm going to be discussing the PrEP use. This was a question that was asked for them in the previous survey they had. And something interesting that the majority, which is more than half of the respondents who were HIV negative, were not using PrEP. And I guess this will go into the discussion with Dr. Mona, one of the panelists later on. But also we can notice like 60% of the folks who were not on PrEP, they said the answer that they will likely be using it in the future. As for the sources of sexual health information, internet friends, which I believe were understandably the most common sources of sexual health information. But what I found was unique in this group in particular is the clinical services were something that were one of the top three in the sources of health information, which was not, I don't recall was with the other groups. Going to the key findings, so about the stigma, race, and sexuality. Of course, homophobia, racism were brought up a lot during the discussions. Experience of stigma, exclusion, the family. So many talked about about the conflict they have, whether do I come out to my family, or if I want to keep my relationship to my family, I have to live this double life, hidden lives. Within the context of self-acceptance, also experiences. Also, what was unique with this, the MSM groups, were I believe they were the most group who were involved in advocacy and volunteer work in comparison with the other groups. Also, this group talked more about experiences of exclusion within the Canadian system, also barriers to the access to healthcare system as well. I'll be sharing also some quotes from the focus group that we had. I'm just gonna give a few seconds if you want to go to read them. Yeah, we can go to the next one. Sweet. So again, going back to the key findings, a lot of what's discussed about the dating and the acceptance within the gay community. So one main theme I also recall was about the drug use and the pressure MENA MSM youth have faced to be more included within what they call the wide gay spaces, which is PMP is one of them. Like you want to be more involved, you want to be more than that. So the drug use was something. Also, the attributions to the Arab bodies, which could be discriminatory at a point or having a fetishizations on these attributes, which also had a conflict within them in the sense of belonging and being included within the MSM Western gay scene. Uh, Also, mental health and safe, accessible healthcare as well. Like that was discussed also a lot, and the importance of mental health support. But what also was discussed is what they mentioned was the lack of mentorship support within the LGBTQ spaces, which also was discussed as a factor that could be engaging in higher sexual risky activities. And also, I'll be sharing some quotes with that. And the last theme that was a big part of the focus group discussions were risky sexual behaviors, PrEP, and HIV. And understandably, I do believe PrEP was more familiar. The discussion about sexual health, HIV, and PrEP were more familiar within this MSM in particular groups. They were more aware of UEQLU and stuff about HIV. Participants also discussed the layered experiences, like coming from their home countries. As we mentioned, like none of them were born in Canada, and this misinformation around HIV between home countries and Canada. Moni, also about the misinformation about PrEP, which is also would be a part of the answer to why the majority were not on PrEP. Of course, to addition to the other barriers to that. Again, and also as we mentioned, like even the majority are not on PrEP. Also, like 60% of them are answered that are likely to be on PrEP in the future. Sweet, thank you, and I'll hand it back to Dr. Loutfy.
Great. Thank you so much, Ahmed. Great presentation. Very interesting findings. And thanks for working as a focus group facilitator for the study. We have some discussion questions, but also if you have questions for Ahmed, specifically any questions about the study and the findings, please feel free to add those into the chat and we can get to those. And if you have any questions for the panelists, please feel free to add those into the chat. So while we're waiting for questions from the audience, panel, are you ready to get talking? Okay. So the first question is, we have heard of the difficulties of navigating sex and dating, either online or in person. How do these challenges associated with stigma, body image, and desirability affect how gay and MSM identified MENA youth seek out and or negotiate sexual health? Is there pressure to conform to mainstream gay spaces?
Can I start?
Yes, please go.
All right, so I've been in Toronto for just over 20 years, and it's been interesting because when I first came out in Toronto, it was pretty much like the amount of LGBTQ Middle Easterners that you could count were like literally on one hand, compared to what it is now. And it's very interesting with that question is how that's changed, that dynamic has changed, and what I'm seeing now. What I'm learning from a lot of newcomers from the Middle East, from MENA, that are here now, they have a voice, they give themselves a voice and so on, and they seem to be more educated on the fact that don't fetishize my body, don't I'm not that to you, or so on. However, I'm also seeing a colonized way of thinking in terms of body image and how to adapt to gay spaces. So a lot of them would come and just hang out with white people with certain body types and wear certain brand names, thinking that that's what they need to conform to, so they could feel like they belong or mix in with the normativity. And I'm putting that in quotes. And that's very problematic in so many ways, because it leads them to negotiate sexual health with those folks that don't necessarily belong to their community or understand their culture, or so on. So, and I'm seeing, because of that, I'm seeing a rise in substance use among MENA folks when it comes to sex and hooking up or meeting someone. So yeah, that's you don't need to conform, and there's a big group out there, which a lot of us are here now and in previous panels, that are not conforming to mainstream gay spaces, but we're still seeing a lot that are really trying hard, because we were made to believe back home that if you behave like a European, you're a certain class and status and so on. So that there's a challenge there for sure.
I'm happy to go next. Can you hear me? Just so I can make sure. All right, great.
Yep.
I thought that was an interesting question, and when I was reflecting on it, I thought about the gay experience or the queer experience as a universal experience. So I thought about it as it not being specific to MENA youth specifically, where typically speaking, I mean, this is anecdotal and personal, but also in conversations with my network, I find that queer individuals tend to always be experiencing cognitive dissonance, where they have on one side they're thinking that they want to be loved, they want to be accepted, they want to be part of the community, but at the same time they are feeling that their identity might be conflicting with cultural norms, social norms, and so those two ideas become quite conflicting, and to resolve that conflict and that feeling of discomfort, they end up looking for ways to make themselves feel better. And within the gay context or the queer context, that is often through validation, external validation from our peers. So issues relating to body image, issues relating to risky sexual behavior become even more amplified. And so put that into the context of MENA youth in North America as newcomers, that becomes even more problematic, because that individual is facing pressures of acceptance on another level. They want to be accepted within their cultural and community, but they also want to be accepted in this new cultural context in North America. And to do that, the sort of vicious cycle of increased pressure of body image and seeking acceptance through or validation through sexual activity becomes sort of an operant conditioning cycle, right? Where every time you're seeking a behavior, you get rewarded for it, and you keep on going back for it because it's what's making you feel good. And all of that, sort of in my way of thinking, is being done so that the person feels or reduces the conflicting ideas of who they are and who others think they are, and so that they can feel good about themselves.
Hello, everyone. It's so nice to be here. It's so nice to be on this panel. I would never have thought, we'd be sitting here today, doing an Arab-centric, MENA-centric kind of discussion. I think it's very important. I will answer the question by emphasizing that it's important to identify that we are racialized bodies at the end of the day. Whatever we look like, despite our very different shades within the Arab community, to each also their own kind of experiences. But it's important for something that took me a long time for myself is I am a racialized body. When I go into these spaces, I am a racialized body. If I date European folks, let's say, there is a very huge power imbalance that I feel from the get-go. So it's very important to see how those factor into our dating and social life, how it factors into people seeing us as sexual endeavors for their inclusivity, but not as a dating potential. And often what that leads to is a lot of gaslighting as well, leaving a lot of our communities kind of marginalized and a lot of our communities feeling left out. And Kiros has also said similar things about, I don't want to date other Arab people. I don't want to be around Arab people. I don't want to be close to Arab neighborhoods if I'm seeking sexual health clinics, for example. So you know how all these kind of different layers, because we're in layered realities, they go into that kind of concept of that prevents them from seeking sexual health support. So what that would look like specifically, how do these concepts challenge sexual health? Education is a big kind of, there's a lot of barriers to education. It makes sex less, not pleasurable, but more of something that is much of a burden. Because there's also a very deep impact of religion and culture on our own bodies that makes us ashamed of our own bodies to seek, I'm harming my body by taking these substances that are not necessary to offset something that's considered sinful. So these kind of ideas, the shame that is associated with it, stops us from actually acquiring those resources. I will also say there is a huge idea around, that gaslighting also goes into our understandings of consent and how that, how we understand our own, how vocal we are and how confident we are about establishing our own boundaries as well as racialized bodies. And moreover, it's also about, finding no community to go to that's confidential. And that is what we're trying to also create over here. There's so many reasons about how that factors in. And I will try to kind of go over them throughout the session. I don't want to take a lot of time right now, but there are so many different things that we've seen from community members as service providers, as, community leaders or members. I've been told over and over again similar stories of gaslighting, of fear of confidentiality, of fear of, even fear from service providers at some point because they would not understand them. They would not feel safe there. So hopefully we'll tackle all these layered realities throughout the session as well. But for now, I'll leave it at that.
Thank you, Maher.
Yes.
Yes,
Sorry,
Rua?
Mina. Thank you so much, Maher. There's a question that's actually directed to Mazen. Can I just read the question?
Sure.
So,
yes.
Mazen, there's a question from Kristen. Do you have any health or safe recommendations for individuals to resolve the conflict you are referring to? I guess based on what you were talking.
It's an interesting actually reflection. I would say, I mean, it's a long process. It's not something that someone can overcome their cognitive dissonance or these feelings of intense emotions for or against themselves in a matter of days, months, or years. It's a long-term process because it's part of our socialization from a young age, from us being children, to how we're cultured and raised with certain values and certain ideas. So it becomes a process of relearning and learning what we already know about ourselves and what is normal, what is correct, what is okay, culturally acceptable, or what lovable or what is not lovable. So I am a huge proponent of talk therapy. I'm a huge proponent of finding your space in your community with either a professional and a strong network of people that that you value. So you know, a specialist can help you navigate through these emotions and thoughts in a safe way, help you learn how to overcome, you know, adversity in ways that with tools that you can have. But your network is really important, because then you can have people people that are role models for you. You know, you can look up to people in your circle and say, you know what, they did it. They're able to manage how, you know, their identity in a very confusing society, and they've been able to do it. How can I model that? So seeking out relationships with people that are have gone through an experience that you're going through, that you can relate to, and you feel safe in sharing where you're at in your journey, and be able to hear how they've overcome that, because everybody has their story. So it's a process. It's not something that you do sort of overnight. It's something that you continually do, and I continually do as an adult, and as a MENA queer, I guess, youth. I wouldn't say I'm a youth anymore, unfortunately, but yes. I hope that answers your question.
Yes, thank you, Mazen, and thank you, Maher. Oh, Kiro, did you want to add something?
Yeah, I just wanted to add something to that based on what Mazen's saying. Is about dismantling and unlearning what we learned. So it's really about how it started off with me and my own lived experiences, is asking myself, where did I learn that from? And is this trauma driven? Is this working out for me at the end of the day, or is this causing more harm than good? And that's when I started really looking into myself to find out what safety in terms of my health meant for me, meeting myself where I am at now, and letting go of those preconceived values, ideologies that were taught, and really dismantling that one at a time, not all at once, because you can't do that, and it's a step process that takes time. So I just wanted to add that as well.
Thanks, Kiro. And the unlearning clearly is a very important aspect of being MENA and MENA youth as it relates to sexuality and sexual health. So as we bring up the next question, I just wanted to expand a little bit on something Maher said in terms of gaslighting. So I'm really glad that you brought that up, because and in the prior sessions we spoke about anti-Arab racism a little bit, but it took me decades to even, like, I didn't know what it was, but there's so much anti-Arab racism, but I feel like, at least in North America, they pretend that it doesn't exist. Dr. Rula spoke about how when you fill out an ethnicity questionnaire, Arab's not even there. We're considered Caucasian. So then we shouldn't feel any racism. The first time that it was really put into words, I don't know if you've read the book, How to Be an Anti-Racist by Ibram X. Kendi, in terms of cultural racism, really anti-Arab racism and cultural racism. So I just wanted to reaffirm, Maher, what you spoke about gaslighting. So thank you for raising that point. So the next question is here. One of the interesting aspects of the findings was the general lower uptake of PrEP from participants, as in more than 50% of those not living with HIV were not taking PrEP. And also, actually, of those not on PrEP, actually 90% of them wanted to be on PrEP in the future, or now, or were considering it. So what do you feel are some of the challenges in learning of or accessing PrEP for young MENA people?
Sexual prudeness. Sexual prudeness, it's something that as Middle Easterners, MENA folks, we've been brought up with. I'll never forget, like I've been out since I was 15, and I'm 38 now, and it's like, you know, I still have that prudence in the back of my head. But when I talk to a lot of Middle Easterners, when PrEP came out, it's like, oh, I don't engage in that risky sexual behavior and so on. But I always call them out because I'm like, that's what you say to me, but I clearly well know on a psychological level behind that closed door, we're very intense sexual beings. It comes within our blood and the way we behave, and we're very sensual and emotional in the way we see sex and connection. So sexual prudence is, and it's related to intergenerational trauma of not having any sexual education, misrepresentation, what's being said at the pulpit by the imam or the priest or the pastor or so on. So all these voices are in the head constantly that's preventing them from hearing out. And a lot of MENA folks will follow within the heteronormativity of understanding what PrEP is, even though they identify as MSM, because that's what we've been taught to follow in order for us to not wanting to be outed. That's another reason why someone would not want to go on PrEP, because it's still known as the gay the gay drug. It's not necessarily, hetero folks don't necessarily use it as much. So there's that linkage as well that's causing problems in terms of accessibility. The other thing is financial accessibility. PrEP is not free. It's not covered at 100%, and that's very problematic. And let's say if youth are covered under their parents' benefits, then they could be outed by their parents' benefits because that will show up as a medication that shows up that their kid used, right? And then the parents ask questions, so it's easier not to do that. And again, it's expensive. It's so expensive. Even the generic is expensive. So those are other barriers added on to the already preconceived notion that I'm not sexually doing anything risky, which which we all know as humans, we have risky behaviors very often, and it's okay. There's no shame, there's no stigma to that. And again, the shame and the stigma plays a huge role. So there's layers, tons of layers that you could peel back with this question for MENA youth, and it's endless. It's endless. So it's about tackling it one at a time. And I think the source of tackle, we need to go from where did they learn that about like sexual prudence and how to dismantle that to help them know that being sexually excited, if we want to try a fetish, a kink or something new in bed, it's not a bad thing. It's actually a beautiful thing, as opposed to seeing it as like, oh my God, that's gross. I would never do that. So yeah.
For sure, I would echo so many of those points. I mean, everything that Kira was saying, I'm like, yep, for sure, I agree. I mean, this question is so multi-layered. I think the part of the onus is on public health officials. There's some countries in the world that have led by example to provide PrEP for free to people. So Brazil, for example, is one of them. And we live in Canada, and you think Canada would be the front runner or leading by example, but we're not. And that's just the reality of it. I mean, when I started using PrEP, that was when I was doing I was in medical school, and my insurance only covered 80% of it. So I was paying about $80 a month for PrEP. And that's just, and I was insured. And so that's a lot of money for a lot of people. It's not accessible. So I think a lot of what we're doing here today, a lot of the work that Dr. Hawa is doing with her group is really informative, because it can then tell policymakers that it is cost effective to provide PrEP for free, and it is an important public health measure to give PrEP to people that need it. And after we've done that, the messaging of PrEP needs to be worked on. As Kira was saying, I mean, I see people in the emerge department, and I mean, again, this is anecdotal, but countless of people that have provided PEP, so post-exposure prophylaxis for people that come in, every 3 to 4 months for PEP use, but refuse to have PrEP because they will be responsible next time, quote unquote, or PrEP is for promiscuous people. I'm not promiscuous. It's just the summer. And it's just like, and it's hard, like it's hard to cancel people like that in an emergency setting because there's so much to unpack in a very, very quick encounter. But those are the realities of how PrEP is marketed or talked about, and even sort of in medical literature, how it's advised, PrEP is for people who are at increased risk of HIV exposure with 2 or more sexual partners. I mean, that's ridiculous. Like it should be just for anyone who is at risk, period, or anyone who's interested, period. Like and so the language that we use medically and the language we give to the community is detrimental, because for MENA youth specifically, we are already self-stigmatizing ourselves with who we are and our identity. So add a level of, now you're telling I'm gonna say that I'm sexually promiscuous. I'm not gonna say that, and so I'm not gonna engage in a behavior that, although it's gonna make me feel safer, it may potentially label me as sexually promiscuous, and that's a no-no. And last thing is primary care providers. I mean, Dr. Loutfy, you're probably one of the pioneers of PrEP in Toronto, but there's so many primary care providers and like family doctors in Toronto that are not PrEP educated and don't quite understand how to prescribe it or how to follow up with their patients that are on PrEP, and so often deny patients PrEP because they don't know, or they're uncomfortable in prescribing it, or they don't know how to follow up with someone every 3 months with the proper follow-up that they require. So it's also a lot of learning and relearning from the medical world that's needed, that public health officials are not investing in. That's it.
Thanks, Mazen. Ahmed, anything you would like to add about challenges for PrEP or even solutions?
Well, I guess here Mazen covered it all up, but within what I heard, like in the focus groups that they'll be held, like the 2 major things, like because mostly they were youth, so mostly they were on their, like they had financial barriers, and they were, as Kira said, on their parents' insurance. So that was a major thing that they were discussing. Also, again, like we don't engage in risky sexual activity, even though like when discussing more and like prompting more question with them, all like the major of the talk was about the factors leading them to do risky sexual activities. So I guess these 2 conflicts would be something but also in the interventions when we were talking, mentorship and educational sessions, more about like in this, starting from school. This was something that they came up with, and I guess tomorrow within the, like if you'd like everyone to join us in the intervention sessions, there are going to be a lot more discussions, behavioral, biomedical, and structural ways that tackle the issue.
Great, thank you, Ahmed. And actually that leads us to the next question that we'll bring up. But yes, Mazen, at the Maple Leaf PrEP Clinic, actually, Dr. Phil and I opened it because we were waiting for public health to open a PrEP clinic in Toronto, and they didn't. So we decided to open a PrEP clinic ourselves. And also we will see anybody and try to figure out a way where PrEP can be covered. We don't want cost to be a barrier. And people in Ontario under 25 are covered, their medications are covered under OHIP+. But it's also about getting the word out there and also dealing with the challenges that you spoke about in terms of their own self-stigma regarding being sexual beings. Okay, question number 3. Many of the participants talked about the value of mentorship in the community. How this might be helpful, and what might this look like?
I guess I can take the lead on that. I actually feed off of the previous question a little bit, is that when we look at the facts, we see that a lot of Arab rates, while other HIV rates are going down, Arab rates are going up. And when we talk about, in general, the reasons for that, I think I just need to mention that there needs to be an onus, not just on the person's shame, on the person's intimidation by all those different things. The onus also needs to be put on the system itself. And, when we look at the social determinants of health, education, access to education, access to economic stability, as they were saying, access to good healthcare. I've went to people who are not trained, who are not queer friendly, who are not also culturally specific content, not very culturally aware. And I was given the wrong prescription often. So what I want to say, like I once asked for PEP and I was given PrEP. So those kind of things make people not feel not supported by the system generally. So when we talk about education specifically as well, we need to look about, like in terms of mentorship specifically, mentorship is a big part of how we can bridge that gap when it comes to social determinants of health and how we can support each other through those barriers. What's important, going off of that point about PrEP, access to PrEP, and the previous question, is mentorship that looks like you. And that is often not very found. The levels of social isolation has actually increased drastically across the pandemic, especially for newcomers who came throughout the pandemic. And there's this, and from the work that we're doing, we're starting to see more projects like the YSMENA project, more projects at ASAP, at 519 Action Positive, at so many different kind of initiatives. And you can see that a sense of community is increasing from the work that we do. So I think having mentorship is a very, very important thing. And, I'm so glad that in the past year we have been seeing more of that. What that can look like in terms of effects, we're already seeing it in the studies that we do, in the data that we collect through our services at ASAP, for example. And, that could look like programs, social groups, peer support groups, connections to mental health practitioners and sexual health clinics that are affirming, that are similar, that are familiar. And someone speaking their language at the end of the day is such an important thing to have to look for in a mentor as well. For one time, I was approached by a trans man who wanted specific support to find community. So I was able to so what I did is I definitely was a mentor in some way, but at the end of the day, the best mentor for that person will be someone else that I know that I can trust and that I can connect them to that person. So that's what mentorship should look like and what it looks like from the work that we're doing as well.
I'm going to play the devil's advocate with that one a bit because I've been at this for so long. And I never, and I said that in the previous, one of the previous sessions, I never thought in a million years I'd be having a YSMENA summit like this one, where I'd be talking with other Middle Easterners, MENA folks that are working so tirelessly. It's hopeful, finally, in so many ways for me. With mentorship within the MENA community, the challenge is they need to show up. They ask, but they don't show up. So, and that's where the challenge is. And there's a lot of wants, a lot of needs, mentorship being one of them. And so one of the solutions that I had come up with was Middle Eastern Nights. Middle Eastern Nights is not just a dance party. It's a place of inclusivity and diversity to let white people know you are in our space, but we are so welcoming, so loving. We're not terrorists. We're not going to, and stop fetishizing us. And it shows the diversity of Middle Easterners and it empowers them through music, culture, and dance type of thing. So I've decided to show mentorship, I guess, in a very different aspect by using creativity. Middle Easterners, we are, whether you're Muslim or Christian, we grew up with art around us, whether it's through iconography or calligraphy or so on. It's such a beautiful method of communication, and music and sound, incense, you name it. So using that to communicate a sense of empowerment to the community, the MENA youth is where it needs to be. But my call out to the MENA folks is, yes, there are people, know that there are people that are welling out to provide mentorship, but show up. They need to show up, not just ask. And that's where the challenge is, because we are trying. And I don't mean to bring down anyone who's here and so on, but I'm sure a lot of people could echo that challenge in mentorship, where we create these things and they don't show up, right? Like I remember throwing group sessions, tea events, and so on, and nobody showed up, right? But Middle Eastern Nights is packed. We get over like 700 to 1,000 people from different walks of the Middle East coming in, and 40% of the attendees are trans-identified Middle Easterners, which is huge, especially in a space like this where they could be free. So this is the type of mentorship that I decided to do. And through my drag, I do gender non-conforming drag to break down the toxic masculinity that affects the Middle Eastern community so badly, in so many ways. So I do that gender fuck thing happening with the beard and so on. I don't tuck and I don't have breasts, but I'm wearing a corset. I'm wearing huge gowns and a big wig, and I'm doing belly dancing. It's very, but it's creating this understanding that we are all in this together, that we really need to provide support and care for each other. So it's a different kind of mentorship, but it's working, and people are showing up to that as well. So we need to kind of figure out, if we are going to provide mentorship, what actually is working, and to continue to elaborate on that more.
Thanks, Kiro. There's been a question, how do we follow or find out about your Middle Eastern nights? Maybe someone can put it in the chat. And it's amazing how you're breaking down the intersections of MENA identity, gender identity, and LGBTQ plus identity. So thank you.
Thank you.
Can we go to the last question? Because I'd really like to take the time with this question to ask each of our panelists, each one of you, to read this question and answer it from your perspective, because I think it's a really important question. And maybe if you don't mind, Madeline, we might start with you, if that's okay. What would you want young gay and MSM youth in the community to know? What messages would you like to leave them with?
I like this. I feel like I'm on RuPaul's last episode. If anyone watches RuPaul's Drag Race, I'm just being facetious, but adds a little bit of flair to this panel discussion. So I think for MSM or young gay youth, especially in the MENA community, I think it's our responsibility to care for each other. I really believe that programs like what we're doing today and initiatives like what Kiro does and what everyone on this panel and the listeners do are really important, because we're starting to break down barriers for MENA youth to talk about their identity, to have self-acceptance. And to recognize that it is not something that is going to happen overnight. We're talking about generational change. We're talking about cultural change. We're talking about change in the way we think. If my mother can do it, we can all do it. And I truly believe that it is our responsibility as people who understand these things and are comfortable and open to talk about breaking cultural barriers, to lead by example, and tying this in with the idea of mentorship. Mentorship doesn't have to be one-on-one. It's role modeling. It's being out there and saying and leading by example. It's being out there and saying that is possible. That what is portrayed in the media of MENA queer youth is not accurate, and is not the definition of MENA gay youth, as the often promiscuous and someone who doesn't have who doesn't have an understanding of who they are. That's not an accurate representation of MENA gay youth, or queer youth. But that's often what people in our community sort of think that's who we are. So I think we should be leading by example, and be patient, because cultural change takes decades, but we're getting there. And we're getting there in North America, and we're getting there around the world.
Thanks, Mazen. Who would like to go next?
I can go next.
Right.
So how much time do we have for this? Because what we're really trying to do here, we need to approach it with a wholesome approach. What we're really trying to do is we're building an empire from the ground up, you know? We don't, you know, it's not going to be built in one day. We need to always show up and be there for each other, just like Hiro said, just like Mazen said. The system here is not built for us. And if there's anything to be learned from historically marginalized communities here, our brothers and sisters from other racialized folks communities as well, is that supporting each other is so critical to this collective success, to this collective empire that we're building together. We need to form our culture together, our art, theater, film, anything. You know, we need to show up to those theater spaces that are occupied not by people who are not working for us. You know, and we don't have to conform to these party spaces either if we're not familiar with them, with like the same culture, because it puts us at harm at the end of the day. Middle Eastern Nights is such a great initiative because, you know, we're building it for ourselves, I guess, in a way. And younger folks, newcomers, need to be part of this. You cannot discuss, you know, forming a new world for people who are not on the table to form it with you. You know what I mean? And that includes the data that you're collecting. That includes everything that we're working on together. We need to reach a shared leadership model. As service providers, I'm not going to be the one person who's doing everything. We're building it together. Even if one person is the leader in such a group, we don't have to see it that way. Because at the end of the day, a shared leadership model is the best thing to do. I will leave with this final note is that years and years, people will tell you that there is a lot of competition for racialized folks between us folks. We've seen it in places like New York. We've seen a lot of division across MENA youth across the world. But the truth is, opportunity does not have to be scarce. They just want racialized people to think it's scarce. And there's no one person that's going to be a hero. We're all going to do it together. So, yeah. So that's the one what I'll leave folks with for now.
Thanks, Maher. I don't see Ahmed anymore. So I guess, Kiro, I'll leave the last word for you.
Thanks. As when Mazen mentioned RuPaul earlier, RuPaul says, if you can't love yourself, how the hell are you going to love somebody else? Can I get an amen up in here? So this always resonated true for me. And where I'm coming with this is that very often we forget to love ourselves. We're trying so hard to fit in with a normativity that's not normal for us. That's very different from who we are. Stop trying to fit into something you're not meant to fit in because we were told that's where we need to fit in, to mix in, to look a certain way, to have a certain career. Let go of these ideologies and find your own voice instead of the voices that have been telling us what to do for a very long time. We have this ideology that we need validation from our parents. When you come out, you might get rejected like I was. No matter what you do, how successful you are, if your parents don't accept you, even if you're a doctor, you're still gay, so that makes you less than. Don't value yourself based on what other people value you or how they validate you. You need to validate yourself first, because otherwise you're never going to win this battle. You're never going to win this battle if you're going to seek other people's validation. So learn how to love yourself. You don't need anybody else's validation and love. You need to do that for yourself first. Everything else will come in line with the confidence, with the knowledge and the empowerment and the vulnerability that you'll gain from just doing that. So that's my advice to the YSMENA youth.
Great. Thank you to our panelists. That was a very powerful discussion and words to leave us with, and a great ending to the excellent summit. Thank you so much, Rula and Vijaya, and thanks everyone, and see you tomorrow.
Okay, I have just one quick couple of announcements, please, everyone, before you leave, aside from the thank yous, because clearly thank you for an amazing day. Just a couple of important announcements. It's a brilliant knowledge sharing event today. Thank you for the committed speakers, panelists, healthcare providers, and all of you, our attendees, for making today such an engaging summit. But we're not done yet. Tonight, we have a youth digital art night facilitated by two brilliant arts-based facilitators, Vijaya Shikharmani and Joanne Pereira. We have 12 MENA youth joining the digital art night. They'll be working to create digital portraits of themselves using a mix of images, words, and graphics collaged together to reflect expressions of identity, culture, and community. And this event is part of our research summit. We are sharing some of the findings, some of the portraits at the beginning of tomorrow's summit. Tomorrow, we have a fantastic lineup in terms of the schedule. Also in Hopin, same time, same place.